Hi everyone, I'm Dr. Divya Shanthi and welcome to NEET PG Core Revision series of Anatomy. These series are focused, structured and exam oriented so that you can recall faster and confidently in your exams. In today's session, we are breaking down the cavernous sinus into clear, high-yielding, exam-focused concepts. So let's get started. Now, cavernous sinus is a paid dural venous sinus. It is a paid dural venous sinus which we see on either side here, either side of the body of the sphenoid. This is the cavernous sinus. Now this sinus, it extends from the superior orbital fissure here up to the apex of the petrous part of the temporal mole. It measures about 2 centimeters in length and 1 centimeter in breadth. So this cavernous sinus, why it is called cavernous is because when the interior of this cavernous sinus is interlaced with reticular fibers, which will give it a spongy appearance, and so it is called as cavernous sinus. Now let's see the borders and the contents of cavernous sinus. So since the cavernous sinus is formed by the two layers of the dura mater, that is the endosteal layer and the meningeal layer, here we can see that the roof, this is the roof of the cavernous sinus, the roof, and this is the lateral wall. Now these two are formed by the meningeal layer of the dura mater, whereas the floor, so this is the floor and this is the medial wall. So these both are formed by the endosteal layer. Of dura mater. So that is how the cavernous sinus is formed. So let's see the contents. The contents of the cavernous sinus are very important. So contents which we see within the sinus and the contents which we see within the sinus as well as the contents which we see along the lateral wall. So coming to the contents, so we have running within the sinus, we have the internal carotid artery. So this internal carotid artery enters the cavernous sinus near the apex of the petrous part of temporal bone through the carotid sulcus there. It passes through the carotid canal, enters there, and then it runs through the cavernous sinus, then pierces the roof and through the 𝗘𝗅𝗺𝗏𝗏 foramen. So that is what we see near the roof, where it will then further divide into branches. Now this internal carotid artery is accompanied by the cranial nerve, that is the abducent nerve. So abducent nerve is the 6th cranial nerve. So it accompanies the internal carotid artery. So it will be little below and slightly lateral to the internal carotid artery within the cavernous sinus. So this also runs through the cavernous sinus. It leaves the cavernous sinus by passing through the tendinous ring of Zinn near the superior orbital fissure. So these two we see within the sinus. Now what are the structures we see in the lateral wall? So now these things we saw within the sinus, right? So now we will see the contents within the lateral wall. So within the lateral wall we see from above downwards. To remember that, remember O-tom. So first O is for the oculomotor. Okay, so which is the 3rd cranial nerve. Then we have trochlear. This is the trochlear nerve, which is the 4th cranial nerve. Then we have the ophthalmic, as well as the maxillary, which are the divisions of trigeminal nerve. So, which row comes first? So, 3 comes before because trigeminal is the 5th one. So, ophthalmic and maxillary, they belong to they are the branches of the trigeminal. So, that is the 5th one. So, 3 comes before 5, right? So, we have the oculomotor first. So, oculomotor, trochlear, ophthalmic and maxillary. These are the structures which are passing through the lateral wall, and they are separated from the venous blood within the sinus through the endothelial lining here. So, they are outside that endothelial lining of the cavernous sinus. So, this oculomotor, it will leave the sinus by passing through the tendinous ring of Zinc by dividing into its 2 divisions. Then we have the trochlear nerve. The trochlear nerve, it leaves the cavernous sinus and passes through the lateral part of the superior orbital fissure. The ophthalmic, it leaves the sinus by dividing into 3 branches: the lacrimal, the frontal and the nasociliary. Lacrimal and frontal leave through the lateral part of the superior orbital fissure, whereas the nasociliary will pass through the tendinous ring, that is within the tendinous ring between the 2 divisions of the oculomotor. And maxillary will leave the sinus by passing through the foramen rotundum. So, these are the contents of the cavernous sinus. Then coming to the tributaries. So, tributaries, when we mean, they are the draining channels which will open into the cavernous sinus. So, cavernous sinus mainly drains venous blood from 3 areas, that is from the orbit, then from the meninges as well as from the brain. So, from the orbit, I said from the orbit, then from the meninges and the brain. So, first we will see from the orbit. So, when we see from the orbit, the tributaries which we see, which drain from the orbit, are the central veins here. Then we have the inferior ophthalmic vein and superior ophthalmic vein. So, these 3 drain from the orbit. Then coming from the meninges, we have the sphenoparietal. This is the sphenoparietal sinus and the middle meningeal vein. The middle meningeal vein. So, middle meningeal vein and these 2, they drain the meninges. Then we have from the brain. So, draining the brain, we have 2. One is the superficial middle cerebral vein, and we have the inferior cerebral vein. Okay. So, these are the veins which drain, or these are the tributaries which drain the different areas of the brain and into the cavernous sinus. So, let's now see the communications. Now, cavernous sinus is a very important site where infections from extracranial can go intracranial. It's a site of intracranial infections which are spread via the extracranial route. So, how do they spread? It is mainly because of its various communications. Now, when we see here, the 2 cavernous sinus, the right and left, they communicate with each other through this anterior, and here we have the posterior. So, anterior and posterior intercavernous sinus. So, these 2 are the intercavernous sinuses through which it will communicate with each other. Then to the facial vein. This is very important. So, facial vein, it communicates via through 2 routes. One is, here we have the superior ophthalmic vein. So, this to angular and from there to the facial. This is one route. It goes to the facial. The other route is, now here all these veins through the emissary veins, okay, through the emissary veins which pass through the foramens, that is, we have in close relation to the cavernous sinus, we have the foramen spinosum, the foramen ovale, foramen of Vesalius, foramen lacerum. Okay, all these foramens are there through which the emissary veins, and emissary veins, we know they are the valveless veins where the blood can flow in either direction, and they connect the extracranial to the intracranial to maintain the pressure, the extracranial, to balance the pressure between the extracranial and intracranial veins. So through these emissary veins, okay, especially in this region, they go to the pterygoid venous plexus, pterygoid venous plexus, and from there it can go to the deep facial vein and then facial vein. Okay, so that is how it spreads. And then we have here the superior, okay, this is the superior petrosal sinus. So superior petrosal sinus, it communicates with the transverse sinus. This is the transverse sinus here. So superior with transverse. Then we have the inferior petrosal sinus here. Inferior petrosal sinus, it will communicate with the sigmoid sinus, and then there it goes to the internal jugular vein. And this is the basilar venous plexus here. So basilar venous plexus, through which it will communicate with the vertebral venous plexus, that is through the foramen magnum. It drains into this, communicates basically with the vertebral venous plexus. So that is how the cavernous sinus communicates with extracranial veins. Then moving on to the clinical correlation. So the septic thrombosis, okay, which we call it as the cavernous sinus thrombosis, is a very common condition because of the spread of infection from the extracranial side. So usually the dangerous area of the face and the orbit, these are the sides mainly, and as well as the nose area, that area which we call it as the dangerous area. Through these places the infection can spread to the cavernous sinus. So already I told you how the communication is there. So for the wider face, it is the angular, the superior ophthalmic vein. So that is how it can go to the cavernous sinus. And from the dangerous area of the nose, we have the deep facial vein draining there. That drains into the pterygoid venous plexus, to which the emissary veins are connected. And through those, it can go through the cavernous sinus. And in the orbit also, again, it is through the superior ophthalmic vein. So what happens because of this? So there is severe pain around the eye. So in the eye region and in the forehead, there will be severe pain. Severe pain and severe pain around the eye as well as the forehead. And there is also ophthalmoplegia. Okay, so there is ophthalmoplegia. So why? Because of the involvement of 3 cranial nerves. So which were the cranial nerves which were passing through? We had the 3rd, we had the 4th as well as the 6th. So because of the involvement of these 3, which supply the muscles there, okay, especially the 4th and 6th, they supply the extraocular muscles there. So there is ophthalmoplegia. Then if you see here, you can see there is severe edema. Severe edema of the eyelids, okay, severe edema of the eyelids along with the exophthalmos. And that is mainly due to the congestion of the orbital veins. So this unilateral cavernous sinus can become bilateral because of the connection, that is through the anterior and posterior intercavernous sinus. Okay, so because of which the infection from one cavernous sinus can spread to the other one. So this is all about the cavernous sinus thrombosis. Then we have one more condition where there can be an arteriovenous communication, that is between the internal carotid artery and the cavernous sinus. So when does that happen? When the internal carotid artery ruptures. Usually that happens in the fracture of base of skull in any trauma. So there is an arteriovenous communication. Because of that, what happens is there is pulsating. Okay, So pulsating exophthalmos. Okay, so this is how we will differentiate between the two conditions. Sometimes even the aneurysm, okay, aneurysm of the internal carotid artery can also rupture. So this also can cause an arteriovenous communication. So there is pulsating exophthalmos. In the cavernous sinus thrombosis, we do not see a pulsating one, but here we see a pulsating exophthalmos. Then there is edema of the eyelids, of course, edema of eyelids, and there is partial or complete, either partial or complete ophthalmoplegia. Okay, then there is a loud systolic murmur over the temporal region. Over temporal region, we see the loud systolic murmur. So usually we treat this by the ligation of the internal carotid artery, but there is always the risk of contralateral hemiplegia in this case when we ligate. So let's now solve some of the image-based MCQs. So here the topmost structure in the lateral wall is. So we know the lateral wall, how do we remember? We remember with the mnemonic O-TOM. So which is the topmost? O is for the third cranial nerve, that is the oculomotor. So which is the answer? So the choice B is the right answer. This next question, which nerve runs close to the internal carotid artery? So which is this nerve running close to the internal carotid artery? It is the sixth cranial nerve, which is the abducent nerve. So which is the right choice here? The D. Answer D is the right choice. Which structure connects facial vein to cavernous sinus? Now this is the facial. So you need to keep two things in mind here. Okay, so there is this facial vein as well as there is the deep facial vein. Okay, so facial vein, when we say it is out here, so you can see this is the facial vein. So facial vein here. So this is the two divisions, the supraorbital and supratrochlear veins, which will join to form here the angular vein, and it continues as the facial vein. So these two will be draining into the superior ophthalmic. So this is the angular here. So through this angular vein, it drains into the cavernous sinus. Okay, so it can go from there. So that connects it. So here the right answer will be the angular. Angular vein is the right answer. Then there is deep facial vein. So when we say deep facial vein here, so the deep facial vein drains into the pterygoid venous plexus, and from the pterygoid venous plexus here, this is the pterygoid venous plexus. So from here through the emissary, it can go to emissary veins, it will go to the cavernous sinus. Okay, so it goes to the cavernous sinus. So these are the two ways. So we need to see what they have given. So if it is just facial vein, then angular vein here will be the right choice. The next question, compression of the lateral wall will first affect. So compression is of the lateral wall. So in the lateral wall, what do we see? We see O-TOM. So we know what is O-TOM, right? They are the four nerves which we see. So it will affect first, which is the first one, which is very close in the topmost, that will be the oculomotor. So oculomotor will be the first which is affected, which is the third cranial nerve. Pituitary gland lies in the within, that is the roof of the sphenoid bone, body of the sphenoid bone. So that is why we exclude that. Internal carotid artery runs within it, and the first choice is abducent nerve. It also runs within the sinus. So I have said compression of the lateral wall. So the right choice here will be the B1. Next question, a patient presents with fever, proptosis and ophthalmoplegia. The image shows venous connection from the face to the cavernous sinus. Which vein is primarily responsible for spread of infection from the danger triangle of face to cavernous sinus? Okay, so retromandibular, facial, angular vein, deep facial vein. So here The face here basically will be the angular vein. So that is the right choice. Then an angiographic image shows an aneurysm of the internal carotid artery within the cavernous sinus. Which clinical feature is most likely? So this cavernous sinus, so this is the aneurysm here. Okay. Aneurysm. So what can happen here? Loss of corneal reflex, ptosis and dilated pupil, loss of facial sensation or mandible, deafness. So these choices, among this, the B is the ptosis and dilated pupil will be the right choice. So with this, we wrap up this session on cavernous sinus. So be consistent with this series because, as you know, consistency is the key to success. So I'll see you in the next session.